Are you suffering from low back pain with one-sided weakness and difficulty engaging your pelvic muscles due to postpartum, perimenopausal, menopausal women? Hi, my name is Annie. Welcome back to my channel, Annie Pilates Physical Therapist. Join me and my beautiful daughter Bella on this simple core stabilizing exercises to help engage your core muscles if you're postpartum, perimenopause, menopausal women with low back pain, or even for men with one-sided weakness and you don't know how to engage your core muscles if you're suffering from back pain. We're going to use a very soft foam roller like mine. This is a 3 inches, which is easier to use, and a 6 inches foam roller, which is more gravity assisted, and they're both great. It's very soft. If you need a good soft foam roller, check the link description below. For limited supply only, and I'm hoping you support my channel by getting this soft foam roller with my logo on it. So let's begin the program right now. If you need my one-on-one hand guidance, check out my back masterclass, a one-on-one coaching. You can check out down the description below and sign up with your name and email address. And also, you can book a free call right now so you can have a free consultation about your back pain so you can eliminate back pain good in 14 days or less. Guarantee. So in this video, let's talk a little bit about one-sided weakness. Why you're suffering from one-sided low back pain. It could be from your pelvis or your hip muscles if you have labral tear, pelvic misalignment, and you've been suffering from this with scoliosis. And if you have scoliosis, then there's a chance you're tilting on your pelvis, and that area where you have the curvature could be where your pelvis is higher, and then one-sided is you're gonna get more impact when every time you make a step. So if you're lopsided one side, we need to slowly lift and engage this weaker side. So we need to start doing some muscle energy techniques and then core strengthening programs. So we begin by lying on back, and we need the foam roller for absolute beginners because most patients can't engage with the very weak hip flexors. So we're gonna lie on your back with the foam roller underneath your pelvis. And the next progression of these muscle energy techniques is without the foam roller. So the 6 inches gives you a little bit more height and stability. And then that's why you need a very soft foam roller. If you have a very firm foam roller, it's very challenging on your back and pelvis. So this is a gentle stretch you can feel. And this is 3 inches foam roller. So it's a little bit further down. And once you're further down on the floor, you're gonna feel more engagement now on your core, especially the lower abs. So if you're weaker on your right side and you're lopsided on your right side, so lift your right side, place your hands on the top of your thigh and gently press on it with your breath. As you breathe in, breathe out, press, and then down. Inhale, exhale, lift and press, and down. My recommendation is to do 10 repetitions to really challenge up to 10 seconds hold. Right now, I'm just giving you a few seconds because I'm sure most of you have a hard time lifting in a tabletop position with pain, weakness, and instability. 2 more. Inhale, exhale, lift. Last one. Well done. Now lower the other leg. So this is lower. Now this one is higher. So you interlock your fingers, place it behind your thighs. The opposite leg now, you switch your leg. And then this one is so high, so much higher on your tilt. So that's why you're gonna press it down and press against it. Breathe in and breathe out, down. And then lift. And press. And do that a few seconds only for absolute beginners. And do that 10 times. As you inhale, exhale. 6 more. Press against your interlocked fingers and down. Try not to do it too fast. Slow and hold it for a second or so until you can do 10 seconds hold. 2 more. Last one. And 1. Now with your both legs up, you make a fist on both hands. Place your hands between your thighs, and then we're gonna glue them together by pressing your knees tight together against your fisted hands. So with your fisted hands, hold it for a few seconds and then let go. Open your knees out to a butterfly to stretch, contract, and then relax, and then squeeze again. For 2 seconds, hold. And then relax and open. It's as you inhale, exhale, squeeze again. Hold, 1, 2, and then open and stretch. As you breathe in and breathe out. And squeeze. 1, 2, and then open. And then squeeze. 1, 2, and do that 10 times as well. You're gonna feel that fatigue now as we glue them together. Now place your hands on the outside of your thighs, and now we're gonna glue them with abduction. Hold it for 10, and relax. 10 seconds hold is my challenge, but let's do it for 2 seconds for now. With you breathe in and breathe out. So having the foam roller here is going to be easier. Just imagine without the foam roller and you lift your leg, it's going to be too hard. See, it's challenging without the foam roller, right, Bella? So with the foam roller, you can lift your both legs up without hurting your spine. So after gluing them together, now you can let go of the foam roller, place it between your thighs. This is soft, so if you don't have a foam roller, you can use a ball, a soft pillow, or a rolled towel. Place your hands on your side as you take a deep breath. Inhale, exhale, bridge. And then inhale, exhale down while squeezing the foam roller. Inhale, exhale, bridge. Inhale, exhale down. Roll down one vertebrae at a time. We have 8 more. Breathe in, breathe out, lift. So this is muscle energy techniques. It will help your pelvic alignment to help build stability if you have one-sided weakness, and then if you have one of your pelvis lower than the other. You need to be consistent to see results. If you do this every single day for the next 2 weeks, you're gonna see much more stability and slowly progress from 2 seconds hold to 10 seconds hold with your breath work, and try your best to really be mind-body awareness to your core. 2 more to go, my friends. Inhale, exhale. And that's it. I'm hoping you enjoyed a lot about this lovely core stabilization using the foam roller, muscle energy techniques to help improve your stability. If you want to get more ideas on how to do this, check out more of my videos, and you can do my one-on-one coaching for free. Check out down below. Click the link on the description below and you can book a free call with me so you can learn more on how to fix your back pain utilizing the core back protocol. And that's why I'm so excited to meet each one of you who needed my help and guidance. If you have any more questions, leave a comment down below. And if you love Pilates, yoga, physical therapy, please subscribe to my channel. Ring the bell so you won't miss anything. Like and share this video. Every like you're giving to my channel, you are supporting me. And that's why muscle energy techniques works, because I've seen it with thousands of my patients who recovered from excruciating back pain, fixed for good. Thank you, Bella, for joining me to these simple exercises to help realign your pelvis if you have one-sided weakness with lateral pelvic tilt. If you have more time today, check out this video about quadratus lumborum pain, and in this video about anterior pelvic tilt position. Until next video, always remember, be safe, be well, and healthy you. Bye!